The Asian Development Bank, known as ADB, injected funding to improve health and nutrition, particularly among poor women and children and ethnic groups in rural areas in Xayaboury province. According to ADB Country Director Sandra Nicoll, the Lao government has set goals for the health sector, which aims to achieve all the health-related MDGs by 2015 and attain universal coverage in healthcare by 2020.
ADB hosted the media tour to Xayaboury province recently, aiming to increase public understanding and awareness through local media on the result of partnership between the government of the Lao PDR and ADB. The press tour covers project sites including provincial capital, health centers, and community benefited from the projects in Paklai district, Xayaboury province, to observe impact of ADB's assistance and cooperation between ADB and the government of the Lao PDR to help improve health and nutrition of populations in underserved areas in Laos through the project implementation.
I think this has been a very successful project. It's we heard from the Department of Health that the province has had great success in moving towards achieving the Millennium Development Goals for health and in water and sanitation. And I think that this project, along with other projects and the government's own initiatives, has made a major contribution to those achievements.
ADB and the Government of Laos cooperation and development in primary health care delivery and rural access road improvement through the Health System Development Project and the Northern GMS Transport Network Improvement Project respectively in 3 areas as improving primary health care delivery, strengthening capacity for health system development, including human resource development, aiming budgeting and coordination among the health network, improving rural access roads and connecting the roads to highway.
We met with the director and the staff, and we could see how dedicated they were to their work, and how they've done a lot of innovations at the hospital to make the maximum use of all the space that they have there.
Health indicators of Laos, such as maternal and infant mortality rates, are among the worst in Asia. To achieve the goal of health for all, the government of Laos has adopted the Millennium Development Strategy, in particular targeting rural poor, ethnic minorities, and women and children.
At the district level, we visited Phonyam village here in Paklai, Suvarna village, and we saw great strides being made in the centers, the health centers there. More people are coming to the centers. There's more women who are receiving, who are delivering their babies with skilled birth attendants present, and so this is all good. This is very good to see.
It is recorded that Lao PDR's key health indicators such as maternal and infant mortality rates are among the worst in Asia. To achieve the goal of health for all, the government of Lao PDR has adopted the Millennium Development Goals and Primary Health Care (PHC) strategy, in particular targeting rural poor, ethnic minorities, and women and children. With its ongoing project, ADB's loan 1,749 supports PHC expansion in 8 northern provinces and strengthening institutional capacity for PHC management nationwide. A network of health facilities has been put in place and volunteers have been trained to improve access. Paramedics and villagers are being trained, many of them from ethnic minorities. This expanded PHC system provides the basis for improving sector impact. However, the health system faces chronic underfunding, management constraints, lack of qualified staff for rural locations, and lack of public education.